Sumeeta Reddy, MD at Apollo Hospitals, joining in right here on ET Now. Ms. Reddy, great to have you on ET Now. Thank you so much for your time. Firstly, I wanted to understand how is it that you see the recent tax cuts impacting healthcare affordability and patient demand at Apollo Hospitals?
No, certainly. I think if you look at the earlier budget where there was a tax cut, this has put more money in the hands of the consumer, and therefore will increase demand, will increase consumption. From a healthcare point of view, we have to first look at the insurance, which now is really 45% of payer mix. This should increase dramatically because of the GST removal. It should make healthcare insurance policies much cheaper. This, coupled with 100% FDI into insurance, should enable insurance companies to grow and to really have larger risk pools for them to manage. So this will create access into corporate hospitals, and we do believe that this is a great enabler for healthcare. Moving down to focusing on issues on day-to-day spending issues, the the rationalization of GST on life-saving drugs is very welcome and much needed because it's moved now from 12% to nil and on some from 5% to nil. And on the rest, it is 5%. On all other medication, it is only 5%. So this is definitely good for consumer, good for the industry, and we welcome it. The reduction in medical devices, consumables, reagents, again moving from 12 to 5, is definitely going to impact the cost of healthcare. Cannot come to you with definite margins at this time, but it is a welcome step towards affordable healthcare. And we at Apollo Hospitals are extremely happy to see this measure. The most important thing is also the outlook on infrastructure. So hospitals like ours are in expansion mode. We are building out new hospitals. So with this, the reduction in GST on fly ash bricks, cement, granite, um, marble, all of this should bring down the cost of construction. And this is crucial for India's healthcare industry today, where we need to create new beds. And the cost of creation was going up tremendously in terms of both because of land and construction costs. So this rationalization will help us build out more beds at a lower cost. So on the whole, I think this is very good for the consumer because even in terms from food products onwards, it's really putting more cash in the hands of the consumer. It's creating access for healthcare. It's enabling healthcare to be more accessible to consumers and patients.
Absolutely. It's a wide range of benefits. But let me pick it
Yes.
up one by one, Ms. Reddy, because
Okay.
you too have presence in insurance, right? Via Apollo 24/7, which is an omni
Yes.
digital health platform, and many other tie-ups as well. How does life
Mm.
change in that? And now do you go more aggressive into insurance?
We have to. I mean, it should have just as buy when you buy a car insurance is mandatory. Health insurance should be mandatory because there should be some health coverage for everyone. This is both a necessity and and a need. So we will continue doing what we do in 24/7, which is insurance broking, creating new products for consumers. So we look at not only offering services, but how do you pay for services? And I think that's 24/7's journey. And broking of health insurance is part of a very significant part of what they do.
Absolutely. Any new innovative products that you're already looking at?
We continue to look at new innovative products. I think the team is doing so.
I also wanted to understand, at a time like this, does it do these GST rationalization steps by the government also make our hospitals more competitive and thereby impact international patients too, and more influx from there?
Yes, definitely. I think that, we're already at 1/10 of international cost. So just being able to offer services and offer value, clinical value at this price is really going to attract more international patients to India. It's definitely a $10 billion opportunity and a window that, we should really be aggressive about selling the Indian hospital service, healthcare services overseas.
So how does it impact your affordability at Apollo hospitals, both from the consumer end and, of course, profitability at your P&L level as well?
No, I think this is something that we'll work out over the next few days because you also want to pass on benefits as to the consumer. And I think the international one where we're looking at 10% of our revenues coming from international patients, definitely affordability for them is an issue, and this will make India more affordable.
Ms. Reddy, specifically, what you reiterated earlier, GST on medical equipments, the fact that it's been reduced from the earlier 12% to now 5%, tell me, how does it reduce the overall cost for hospitals such as yours?
So if you're looking at consumables, I think it's about 10% of revenue. And there, when you see the GST coming down, I think there should be an improvement in our overall cost matrix. And therefore, we need to see how much it is and what impact it is. Right now, it's just come to us, and I must say that we're very pleased to see it, but we will work out the numbers. I'm sure it'll be good for the industry as well as for the patients.
It sure is. And one can see that in all the smiles of all the consumers and, of course, businesses such as yours as well. Great having you on the show today, Ms. Reddy.
Thank you.
Thank
I
you
just
so
wanted to
much.
clarify
Yes.
that this is for consumables and disposables. Medical equipment still attracts a duty, and probably that will be a part of our next conversation with the ministry.
Here's to GST 3.0. Shall we say that?
Yes, yes, yes. Thank you. Thank you.
Okay. Thank you for your time.